Have you ever wondered why your stomach hurts sometimes? We all have, at some point, experienced discomfort in our digestive system. Today, we delve into the world of science, specifically focusing on common digestive system diseases. Understanding these conditions is crucial as it affects our everyday life. We're going to uncover the mysteries of gastritis, constipation, typhoid, and diarrhea. By the end of this journey, you'll gain a better understanding of these diseases. In this video, we'll go through 4 common digestive system diseases. First up, we have gastritis. Now, you might be wondering, what exactly is gastritis? Well, in simple terms, it's an inflammation, irritation, or erosion of the stomach lining. Think of the stomach lining as a protective barrier against the acids that help digest food. When this barrier gets inflamed or damaged, that's when gastritis comes into play. There are several common causes of gastritis. It can be due to a bacterial infection, like H. pylori, or it might result from the long-term use of pain relievers such as aspirin and ibuprofen, which can weaken the stomach lining. Excessive alcohol consumption and stress can also trigger gastritis. You might be experiencing gastritis if you've been having stomach upset or pain, nausea, or vomiting. More serious symptoms include a feeling of fullness in your upper abdomen after eating and unintended weight loss. Now let's talk about the risk factors. Anyone can develop gastritis, really. But certain factors like older age, excessive alcohol use, chronic vomiting, stress, and the use of certain medications increase the risk. But don't worry, gastritis is typically treatable. Depending on the cause, treatment might involve taking antibiotics, proton pump inhibitors, or even just making changes to your diet and lifestyle. So, how do you prevent gastritis? Well, by avoiding the things that irritate your stomach lining, of course. That includes limiting alcohol intake, managing stress, and using caution with pain relievers. Taking care of your stomach lining is indeed crucial to prevent gastritis. Moving on to a common yet often ignored issue, constipation. This is a condition where your bowel movements become infrequent or hard to pass. It's more than just a minor inconvenience. Constipation can seriously impact your digestion and overall quality of life. Now, what causes constipation? It's often due to a lack of fiber in the diet, inadequate fluid intake, or a sudden change in diet or routine. Certain medications, lack of physical activity, or ignoring the urge to go can also lead to constipation. So how would you know if you're constipated? Symptoms vary, but most commonly include having fewer than 3 bowel movements a week, straining during bowel movements, feeling as though there's a blockage or that you can't completely empty your bowels. Those at higher risk include the elderly, individuals who are bedridden, or those with certain medical conditions like diabetes or thyroid disorders. Pregnant women are also at an increased risk due to hormonal changes that slow digestion. Now let's talk solutions. Increasing fiber intake, drinking plenty of water, and regular exercise can alleviate and even prevent constipation. Over-the-counter or prescription medications may also be used under a doctor's guidance. But remember, these are not long-term solutions. A balanced diet and healthy lifestyle are key to preventing constipation and maintaining a healthy digestive system. Remember, regular bowel movements are a sign of a healthy digestive system. Next, we discuss a serious bacterial infection, typhoid. This illness is caused by the bacterium Salmonella typhi. Unlike other forms of Salmonella, this strain is only found in humans, making it a particularly potent and dangerous disease. Typhoid is primarily spread through contaminated food and water. This means that it's usually prevalent in areas where sanitation is poor and clean water is hard to come by. In some cases, it can also be spread by carriers who harbor the bacteria, but don't show any symptoms. The symptoms of typhoid can range from mild to severe. They usually start showing 1 to 3 weeks after exposure to the bacteria. These may include a high fever, weakness, stomach pains, headache, or loss of appetite. In some cases, a rash of flat, rose-colored spots may also appear. Now let's talk about the risk factors. As mentioned before, typhoid is more common in places with poor sanitation and limited access to clean water. However, it's also a concern for travelers who visit such regions. When it comes to treatment, antibiotics are the most commonly used method to kill the bacteria. However, there's increasing concern about antibiotic-resistant strains of the bacteria. This is why prevention is so important. Preventing typhoid involves improving sanitation and access to clean water. Vaccination is also available and is recommended for those traveling to high-risk areas. Staying hygienic and safe is the key to avoid typhoid. Let's now talk about a common ailment, diarrhea. It's one of those topics that people often shy away from, but it's essential to understand it, given how frequently it affects individuals worldwide. Diarrhea, in the simplest terms, is characterized by loose or watery stools. It's the body's way of clearing out certain toxins or responding to an upset in the digestive system. Now, what causes diarrhea? Quite a number of things, actually. It can be the result of an infection such as a virus, bacteria, or parasite. Certain medications, food intolerances, and diseases affecting the digestive system, like Crohn's disease or irritable bowel syndrome, can also trigger diarrhea. The symptoms of diarrhea are fairly recognizable: frequent loose, watery stools, abdominal cramps, and a sense of urgency to have a bowel movement. However, it's important to note that prolonged diarrhea can lead to serious dehydration, which is a significant risk factor, especially in children and older adults. So, how do we treat diarrhea? Mild cases usually resolve on their own with rest, hydration, and a bland diet. Over-the-counter medications can also help, but for persistent or severe cases, it's crucial to seek medical attention. As for prevention, maintaining good hygiene, especially hand washing and safe food practices, can go a long way in keeping those uncomfortable trips to the bathroom at bay. Ensure to stay hydrated and well-nourished to combat diarrhea. We've covered 4 common digestive disorders. We began with gastritis, a condition that inflames the stomach lining, potentially causing discomfort and, in severe cases, ulcers. We then moved on to constipation, a common yet often overlooked issue that can significantly disrupt daily life. Next, we delved into the world of typhoid, a bacterial infection that can lead to serious complications if left untreated. And finally, we examined diarrhea, a disorder that, while typically short-lived, can be dangerous if it leads to dehydration. Each of these disorders, while different in their nature, share a common thread: they all affect our digestive system. This system is crucial to our overall health, breaking down the food we eat into nutrients for our bodies. When it's not working properly, our entire body can feel the effects. So it's crucial to understand these disorders, their symptoms, and treatment options. Stay tuned for some quick tips on maintaining digestive health. So, how can we maintain a healthy digestive system? Let's dive into some simple yet effective ways to keep our digestion running smoothly. First and foremost, diet plays a crucial role. Incorporating a variety of fruits, vegetables, lean proteins, and whole grains into your meals can provide the necessary nutrients for optimal digestive health. Fiber in particular can help prevent constipation and promote regular bowel movements. Hydration is another key factor. Drinking plenty of water aids in digestion by softening your stool and promoting regular bowel movements. It also helps the body absorb essential nutrients. Regular exercise not only keeps you fit, but also stimulates the muscles in your gut, helping to push food through your digestive system more effectively. Whether it's a brisk walk, a yoga session, or a vigorous workout, find an activity that you enjoy and make it a part of your daily routine. Lastly, lifestyle choices significantly impact your digestive health. Reducing stress, getting enough sleep, and avoiding harmful habits like smoking and excessive alcohol consumption can go a long way in maintaining a healthy digestive system. Remember, these tips are not a one-size-fits-all solution. Everyone's body is unique, and what works for one person may not work for another. It's always beneficial to consult with a healthcare professional to understand your specific needs better. Remember, a healthy digestive system contributes to overall well-being. Let's quickly recap what we've learned today. Our journey into the world of digestive system diseases took us through the terrains of gastritis, constipation, typhoid, and diarrhea. We unraveled the mysteries behind these common yet often misunderstood health issues, shedding light on their causes, symptoms, and risk factors. We also discussed the vital role of treatment options and prevention measures in managing these conditions. Remember, understanding these diseases is the first step in effectively dealing with them. Equipped with this knowledge, we can now appreciate the significance of maintaining a healthy digestive system. It's not just about avoiding discomfort or pain, it's about preserving our overall health and well-being. From eating a balanced diet and staying hydrated to exercising regularly and making wise lifestyle choices, every little step counts. So, don't just sit there. Take proactive steps for your digestive health. Thank you for watching. Feel free to like, subscribe, and share this video to spread awareness on digestive health. You'll find additional resources and links in the description box below. Stay healthy and keep learning. Before you go, take a moment to explore our channel and discover more fascinating science topics. We've got plenty of related videos that you'll find intriguing. Don't forget to subscribe and engage with our channel for more informative content.